Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I'm a neurologist, headache doctor, and today I'm talking about migraine headache symptoms for beginners. Pain in the head is universally thought to be a concerning, very bothersome problem. Most headaches, 99% in fact, are either tension-type headache, which is 70% of headache, or migraine, which is about 30% of headache. Only about 1% of headaches are something else. Many persons are moderately and some are severely disabled by headaches, and these are usually persons with migraine, because migraine is more severe and has nausea and the need to lie down, while tension-type headache is just mild to moderate, tight pressure headaches. Many persons don't recognize a definite diagnosis for their headaches. They think, it's just a headache. The purpose of this article, then, is to explain migraine headache symptoms for beginners so that they may know and later have it confirmed by a neurologist and negative testing that they have migraine. So, migraine headache symptoms for beginners is best explained by stating that migraine is a primary headache problem which comes with repeating moderate to severe headaches. Migraine usually is a one-sided headache which may be throbbing or pulsating and last from 4 to 72 hours. Along with the headache, many persons may have nausea, vomiting, and sensitivity to light, sound, and smell during the headache. Migraine is found as 12% of the world population, being more prevalent in women, 25%, than men, 6%. The pain of the headache is made worse by activity, so that many persons have to lie down and rest or sleep during the headache. Primary in medicine means that the exact cause is not understood, like primary hypertension, which is a common medical problem with no known cause in about 90% of persons. About 30% of persons with migraine may have an aura that comes before the headache starts. Usually, there is a visual aura of seeing stars, zigzag flashing objects, or half of things which move. The aura typically comes just before the headache starts, but may come in the middle or at the end of the headache. Sometimes the aura may come with no headache, especially at the ages of 50 to 70 years old. This is called migraine cine migraine, acephalic migraine, or silent migraine. Other rare aura symptoms are numbness on one side of the body, usually involving the fingers, hand, arm, cheek, and then tongue on one side. Some persons have trouble speaking normally and cannot produce words or mix up words. Related questions. What is the cause of migraine? Migraine is thought to be due to mixed genetic and familial factors. Certain genes for migraine have been isolated, but migraine is a complicated, multi-genetic medical problem. What is the pathophysiology of migraine? This is also not completely understood, but during a migraine, the trigeminal nerve, the sensory nerve of the face, is activated, causing the ganglia of the trigeminal nerve and the cerebral artery to release 3 inflammatory neurochemicals, neurokinin A, substance P, and CGRP. These neurochemicals cause the cerebral arteries to dilate, and then inflammation of the thalamus, which is the human brain pain center. These chemicals last in the brain 4 to 72 hours and then drain down into the abdomen to the liver, where they're metabolized and next are eliminated from the body in the toilet. Why do women have more migraine than men? Part of the reason has to do with estrogen, which female ovaries start to secrete during menarche, the name of the timing of the first menstrual cycle, between the ages of 10 and 16 years old. The withdrawal of estrogen during the 3rd week of the female cycle sets off a migraine headache in susceptible women. When is migraine at its worst? The worst time for migraine headaches is during female middle age, 30, 40, 50. When does migraine get better? Migraine usually improves after menopause and after age 50 to 60. What does the man or woman in the street erroneously call migraine? Migraine has pseudonyms or false names that are used, which prevents many persons from understanding that the headaches they have are really migraine. These false names are sinus headache, menstrual headache, hungry headache, nocturnal headache, one-sided headache, holiday headache, or letdown headache, or barometric pressure headache. What are one-sided migraine headaches like? The most common of all migraine symptoms is that it may be one-sided. Headache with a migraine may be one-sided or generalized, often in the front of the head, in the temple, or behind the eyes, or one eye, but sometimes they start in the back of the head and move forward to be behind one eye only. How bad do migraine headaches get? Considering pain could be quantified on a scale of 1 to 10. Migraine headaches are usually over 5 and commonly 8 to 10. Migraine headaches can last 72 hours? A single episode of migraine may last 4 to 72 hours, but headaches lasting longer than that are usually caused by overtreatment, and the common drugs used for overtreatment are caffeine, Tylenol, Advil, Aleve, NSAIDs, opiate narcotics, butalbital headache drugs, or triptans. In the migraine world, overtreatment may result from using one of the above drugs more than 2 days a week. The principle is that the stronger the drug, like a narcotic, the less amount of the drug is needed to cause daily headaches. For instance, caffeine or Tylenol or Advil or NSAIDs taken 15 days a month may give daily headaches to some migraine patients. However, narcotics such as opiate-containing drugs, barbiturate drugs, or triptans may give daily headaches if taken only 10 days a month. I've heard that migraine has stages. Is that right? A migraine lasting longer than 72 hours is termed status migrainosus. There are 4 possible phases to a migraine, although not all the phases are always experienced. The prodrome, which occurs hours or days before the headache. The aura, which immediately precedes the headache. The pain phase, also known as the headache phase, lasting 4 to 72 hours. The postdrome, the effects experienced following the end of a migraine attack. Prodrome phase. Prodromal or premonitory symptoms occur in about 60% of those with migraine and may come on from 2 to 4 hours or 2 to days before the onset of pain or the aura. These symptoms may occur in those with either migraine with aura or migraine without aura, and include a wide variety of phenomena such as altered mood, irritability, depression or euphoria, fatigue, craving for certain foods, stiff muscles, especially in the neck, constipation or diarrhea, and sensitivity to smells or noise. The aura phase. The migraineur may see a blind spot, which is a negative scotoma, or positive scotoma, which may be a flickering, scintillating, zigzag pattern of images near the center of vision, which usually move. Following the visual images, there may be a tingling or pins and needle feeling in the fingers of one hand, then the forearm, and then the same side of the cheek or tongue area. Following this, there may be trouble forming or finding words called aphasia or dysphagia. The auras last less than 60 minutes. The pain phase. A typical migraine headache is one-sided, unilateral, throbbing, and moderate to severe in intensity. There may be a gradual onset to peak time of about an hour or so. The patient feels worse with being up or physical activity. Commonly, there may be neck pain associated with a migraine, which is on the same side in the back of the head as the pain in the front of the head if the pain is one-sided. The pain phase comes with nausea, 90% vomiting, 33% sensitivity to light, sensitivity to sound, sensitivity to smells, fatigue, and irritability. Many persons want to lie down in a dark, quiet room. There also may be blurred vision, nasal stuffiness, diarrhea, frequent urination, pallor or sweating. Scalp swelling or tenderness may occur. Elderly persons have fewer associated symptoms other than the headache and nausea. Postdrome. The migraine postdrome may be a sore head, especially where the migraine was, impaired thinking for a few days, feeling tired or hungover, mood changes, gastrointestinal symptoms. Some people feel unusually refreshed or euphoric after an attack, whereas others note depression and malaise. Now that you know what a migraine really is, get medical help and adequate treatment for your headaches from a primary care doctor, internal medicine doctor, or neurologist. And if over-the-counter drugs don't work, see a doctor for that sinus headache, which is really a migraine. Thank you very much for listening to me. Please click subscribe down there so we can follow each other. God bless all you persons with migraine, and I'll see you on the next talk.